General Manager Tony Mazzucco is here to provide us with an update on how the town is operating through the COVID-19 pandemic.
Hi folks, General Manager Tony Mazzucco here, coming to you with a special monthly update. As many of you may be aware, on Wednesday, Governor Baker ordered that all non-essential businesses remain closed until May 4th. Here's what this means for us here in Norwood. Town Hall will remain closed to the public with services available online or via appointment. Schools are closed until May 4th. The Civic and the library will remain closed to the public and only offering services that can be offered remotely or without congregating. This may have an impact on seasonal programming. It's still too early to determine that yet. Current operational changes as a result of COVID-19 at the Norwood Fire, Norwood Police, Norwood Light, and the Public Works Department will remain in effect until at least May 4th. The town election has been rescheduled to early June and town meeting until late June, pending a final vote of the Board of Selectmen in the next couple of weeks. I'd also like to announce that we're launching a Citizen Information Center. Beginning Monday, April 6th, we're launching this new Citizen Information Center. This is a one-stop shop for questions, comments, and concerns residents have. We have staff assigned from 8 to 4 Monday through Friday to answer questions and help you get access to whatever resources you need. Things will be slow at first as we develop networks and access to resources, but you can call us with any problems you're having, questions you may have, or assistance you may need, and our call takers will work to get you that information. We're here to help, and you can call us at 781-352-2363 Monday through Friday, 8 to 4. Callers will take your information down, research and answer for you, and get back to you. We know there's a lot of information out there, and we want you to have one place to call so we can help you navigate through. Call us. We are here to help. I want to talk for a moment about how we make decisions during an emergency in the town of Norwood. Our emergency operations procedures are similar to many communities in the country when an emergency is presented. A state of emergency is declared, an incident command system established to manage the incident. Decisions are run through the incident command team. Our model in Norwood has us operating on consensus, with all decisions being viewed through a public health lens, as this is a public health emergency, and we need to look at our decisions and our actions in that context. Our ICS team consists of myself, Sigal Reese, our health director, Bernie Cooper, our assistant general manager, Kathy Carney, our director of administrative services, and Stacy Lane, our assistant health director and public health nurse. We meet every morning, digitally of course, and review our command briefing and action items. Weekly, we have a larger call with an expanded group that includes public safety, leadership from the Board of Selectmen and the Board of Health, and the school department. There are also a number of other routine meetings, all digitally of course, with partners such as the hospital, and numerous briefings and conference calls with our counterparts, the Federal Emergency Management Agency, the Massachusetts Emergency Management Agency, the Department of Public Health, and others. We also have staff assigned as liaisons focusing on critical areas of need in the community, such as monitoring grocery stores, food security, and other facilities. I know that this crisis is taking a toll on society, but I'm also keenly aware of the impact it's having on many people's mental health and well-being. I'd like everyone to take some time to reflect on where you are, how you're doing, and what you can do to keep you and your family well during this crisis. We have information on the Impact Norwood website about access to various mental health resources. Please take a look, as we want everyone to take care of themselves during this emergency. I also want to take a moment to talk about the next few weeks and what we're going to see. In the next few weeks, we anticipate the Commonwealth hitting what we call the peak or the surge of viral infections and hospitalizations. This will be a period of maximum pressure on hospitals, with many reaching or exceeding capacity. This will likely be the hardest period of time for the community, certainly most so for those on the front lines, but for all of us. There will be challenging news coming out about overworked and overloaded hospitals, and the number of individuals testing positive for COVID-19, and unfortunately the number of deaths, will rise as well. After some time at peak, growth in the numbers will slow, and then the total number overall will decrease. The exact timeline is unknown, of course, and could change in either direction. The coming surge will be the most challenging time for us in the community, and healthcare workers in particular. The news you see on TV may be grim. We have to show empathy for those suffering and those continuing to work during these conditions, and we here at the town are committed to continuing to do what must be done for our community and for each other. We're here to help, and we're here to serve the community. So where do we go from here? We face unprecedented times that will continue to test us as a community. Despite the greatest public health emergency we faced in a century, despite some of the negativity and the loss and the coming challenges of recovery, we will overcome. I say this not out of a simple desire or obligation just to sound optimistic, but out of an honest look at what we have already overcome, what we have achieved, and what we have produced. If you think about it, in less than 30 days, society has completely upended itself. Our entire lifestyle has changed. We've completely changed how we work, how we shop, how we communicate, how we educate, how we interact with each other, all in under a month. The resiliency shown by our community has been nothing short of breathtaking during this period of unimaginable change. What has not changed, however, is our sense of charity, our sense of community, and our commitment to our neighbors and to each other. That has always been Norwood's greatest strength, and that is what will see us through these challenging times. A favorite author of mine once said, "What will come, and we will meet it when it does." We've got this, Norwood.